Our next case here is from the pleura. So if we look here, we can see an area of a pleural plaque. So we have this dense collagenous fibrous tissue that really has this nice layered appearance to it with these interspersed holes that are characteristic called a basket weave appearance that's consistent with a pleural plaque, which is typically seen in patients that are exposed to asbestos. If we move to the side here, we can see that there's this proliferation of these epithelioid cells. They do look fairly bland, and that is often what we see in mesothelioma is that they look a little bit more on the monotonous bland side in comparison to carcinoma. And they're forming these tubular structures that are diffusely invading down and getting into the underlying fibroadipose tissue. So when these epithelioid cells invade into the underlying tissue, such as in this case the fibroadipose tissue, or if it is using the visceral pleura into the lung parenchyma, this allows you to get the diagnosis of a malignant mesothelioma. We then subtype these into epithelioid or sarcomatoid. These are epithelioid mesothelioma. And it is important to exclude a carcinoma. And to do that, we typically rely on immunohistochemical stains. And there's no one stain that is perfectly sensitive or specific, so we usually use a battery or a panel of stains to differentiate that. In most cases, you should use at least two mesothelial and two carcinoma markers. Mesothelial markers include WT1, calretinin, cytokeratin 5/6, and carcinoma markers include BRCA4, MOC31, polyclonal CEA, TTF1 as well. And so using that panel, we would expect this case to be positive for calretinin and WT1, negative for polyclonal CEA and BRCA4. And so this would be an epithelioid, malignant epithelioid mesothelioma.